Public Service and Administration from the Bush School of Government. Before coming to work at AAPLOG and AAPLOG Action last year, I worked in the Texas House of Representatives for Texas Right to Life and on Capitol Hill.
And I'm Jamie Dangers. I'm the vice chair of the board of AAPLOG Action, which is the new C4 advocacy arm of AAPLOG. And my day job is I serve as the director of federal affairs at Susan B. Anthony Pro-Life America, which is a political pro-life organization. So in that role, I help lead our federal affairs team to advance our pro-life policies in the federal government on Capitol Hill and in this administration, offering what help we can in advancing pro-life policies. And before I was at SBA, I've been there about 6 years. I worked on Capitol Hill, working on the life issue, working on religious freedom issues, domestic and global. And I worked at pro-life nonprofits in Washington, D.C. and Colorado Springs. I got my bachelor's at John Brown University in Northwest Arkansas, and I have a Master of Arts in Government through Hillsdale College.
Yeah, so we're hosting this webinar because we know that we're standing at this pivotal moment in our nation's history for our movement, and one in which the abortion landscape can change profoundly for the next 4 years and beyond. And honestly, in just like the 4 weeks, a lot has already happened. And so we want to talk about that. These changes are going to impact American medical professionals, pregnant women, preborn children, and more. So, like I said, we've seen a lot of abortion-related news coming out of the new presidential administration at a very rapid pace. And I know we're having a hard time keeping up, even as it's our full-time jobs. So we thought we would do our best to get you caught up and understand what this administration has done so far, what it might do moving forward, and what all of this means for medical professionals and their patients. So feel free to engage with us with your thoughts and your questions in the chat. And then our moderator, Miriam, will be collecting all of those, and she'll be saving them in the Q&A portion of this webinar that'll be a little bit later. And we'll try to get to all of your questions. But if we can't, we'll be sure to answer them in the near future with a follow-up email. So we'll go ahead and hop right in with a first question, Jamie, for us to talk about is kind of probably the thing that is most forefront on people's radar, which is Robert F. Kennedy Jr. He's President Trump's nominee, now confirmed, for Secretary of Department of Health and Human Services, or HHS. And so can you just start by catching up viewers about, what's been going on with this nomination?
Sure. I think everyone knows Robert F. Kennedy Jr. was himself a presidential candidate for a while, but then he lent his support to President Trump, and his focus has been very much on it's MAHA, the Make America Healthy Again agenda. And so he was nominated by President Trump to lead HHS, the Health and Human Services. And for those of us who are paying attention to the life issue, that was a little bit of a surprise because he has kind of a mixed track record on the life issue. So we were all kind of watching to see how he would engage with that issue moving forward in the confirmation process. So what happened on the Hill was he went before 2 different committees in the Senate Finance Committee and the Senate Health, Education, Labor, and Pensions Committee. And at those hearings, they were able to ask him a bunch of questions about what he believes on all sorts of different topics and how he would implement those policies if he were to be confirmed, which, as Rebecca said, he was actually confirmed today. So he is our HHS secretary. And several senators asked him some really helpful questions on how he would implement pro-life policies at HHS. And it was encouraging to hear him say, not only I'll do what the president wants me to do, but also to engage on some of these topics and show how much he's actually thinking about them and committing to more of a pro-life agenda than I think maybe some would have thought when he was first nominated.
So one thing, Jamie, can you help us? I think I know when I heard that he was going to be before two committees, and one of them is finance. That feels really weird. Like the health one makes sense, but the finance one is weird. And so, can you just help us understand, like, why was he before both, and why were they the ones who got to decide on him moving forward or not?
Yeah, that's a great question. So that was also surprising to me. But the Finance Committee has jurisdiction over large government programs like Medicaid and Medicare and things like that. So, health insurance coverage, that those sorts of things run through finance as their jurisdiction. Even laws like EMTALA, the Emergency Medical Treatment and Labor Act, there was a hearing in the Finance Committee last year because they had jurisdiction over that, which I also learned last year. So the HELP Committee, the Health Education, Labor and Pensions Committee, also has a huge role to play in the health area, obviously by their name. But their hearing with RFK Jr. was a courtesy hearing, meaning they got to ask him their questions. Everything was on record. It was an important hearing, but it was the Finance Committee that actually voted on whether to advance his nomination out of the committee and onto the Senate floor.
So thinking about like the policies you mentioned that he was asked about, and I know a lot of us in the movement were concerned about, we at AAPLOG actually sent a letter to our Republican senators ahead of the hearings and asked them, these are some of the things that for us are non-negotiables. Like we need to know, and not just for RFK Jr., but for all of the HHS nominees, like these are non-negotiable policies that we really need to see what their stances are and where they are committed. And those were things like protection of conscience rights for all medical professionals and entities, especially medical students, clarification about their stance on induced abortion later in pregnancy and what they believe is the proper gestational limit, transparency when it comes to peer-reviewed publications so that we actually have right data and it's not being censored in any way about induced abortion and mifepristone and pregnancy outcomes. And then the last piece that we asked about was stronger safety regulations for mifepristone, the one of the pills in the abortion drug protocol, including reinstatement of its original approval process. And so those are a lot of things. And we actually heard the senators ask about a lot of those things and him talk about a lot of them. So I guess, can we go through those and just kind of highlight how the hearings were actually heartening, to hear him answer some of those questions?
Yeah, it was really interesting because he gave substantive answers on a lot of those things. It wasn't just, I'll do what the president tells me to do, which is what a lot of nominees say. So that they don't have to get into the substance. But I think one of the really interesting things about RFK Jr. is that he is not beholden to big pharma or to the way things have always been done. He is comfortable asking questions about the status quo. And so that came through a lot in the questions that were asked of him related to mifepristone and to how the FDA has not only looked the other way related to complications and risks of those drugs, but has actually intentionally tamped down the ability for us to even know what those complications are. Because like you said, some of the original approvals that have been rolled back, or the requirements, included adverse event reporting.
Right.
If there was a complication, it makes sense that you should report that so that the FDA knows when a drug is dangerous. But under the latest changes, under the Biden administration, you don't even have to report complications unless the woman or the girl has died. That's pretty shocking. And so things like that, I think we heard RFK saying, well, if there are issues, we should look at that. Let's do real studies. Let's see what the complications are. And he was asking questions, which I'm encouraged by, because for a long time, the fake science and the abortion distortion science has ruled the day at the FDA. And I think he's going to he's going to question a lot of that. What did you think about his take on, you asked about like complication, or excuse me, conscience protections and things like that. Were you encouraged by some of the things you heard? Is there more you still need to hear? What are your
Yeah,
thoughts there?
so I think, like you said, on some of those other things, especially the abortion related things, his answers were vague but heartening. But on conscience protections, I think he made just a super clear statement. And I was actually reviewing earlier, and I found this quote from the hearing, and he says, quote, forcing somebody to participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We welcome diversity. And he kind of goes on. And so, just very clearly committed to protecting the conscience rights of our medical professionals. And as patients, that's so important because we don't want medical professionals who are doing something that violates their conscience. But also for APLOG's membership, we want to protect our medical professionals and medical students who are facing the most pressure in these situations because they don't have that tenure, to help back them up at this point. They're still so early in their career. So I think that was super heartening to hear. And especially, and I know we'll talk about this more as we go on, but just the role that HHS has over conscience protections, to hear him speak so boldly for that was really encouraging for us. And I think you're right. I think he repeatedly said that he would do what President Trump directed him to. And I think to some extent, that felt like a cop out, but like you said, that's what a lot of them say, and that is their job. But also from some of the stuff he was sharing, it sounds like he and President Trump have talked about some of these things, and that President Trump, is he wants to end late term abortions. These are from the things he said in the hearing. He wants to end late term abortions. He wants him to look into adverse events and the study of mifepristone and safety of mifepristone. And he also actually came out and said he would hire pro-life deputies in his agency, which is huge because, it's important who he is, but his deputies are so important too. So, yeah, I think it was overall really heartening. Was there anything else that you took away from, just, I guess, now, like, kind of past hearings? He's been confirmed now, and so, how should we kind of process feeling moving forward about this whole process?
Mhm. Well, HHS is really the hub of most of pro-life policies at the executive level. Other agencies come into play for sure, but HHS is really where most things happen, or at least where they begin. And so I think there are going to be some things that can happen quickly, but some things that he talked about in his hearings, even like reinstating the protect life rule, that could be a multi-year process to do actual rule making. So there are some things. The protect life rule is a policy that was, or a rule that Trump had implemented in his first administration, that basically said, if you're getting Title X family planning funding through the federal government, then you have to be completely financially and physically separated from abortion businesses. And so it made sense because family planning is not abortion. Abortion is not family planning. But Planned Parenthood gets a lot of Title X money. And abortion is, as we know, America's abortion giant. And under the first Trump administration, they chose abortion over federal funding. And so for the first time, they were defunded of around $60 million. So we're hoping to see that implemented again. And RFK Jr. did talk about that, but that will take some time to go through the rulemaking process. So there are some things that can happen pretty quickly, but others will just have to be patient and then be ready to submit comments because part of the rulemaking process requires the policies to be published and to get feedback from the public. So it would be incredible if APLOG members would give their medical opinion of these pro-life policies and how they are actually helpful and actually make sense in the health space. So once we get to rulemaking, there's going to be work on our part too to ensure that that those are strong and have good support.
I love that because I think that's one of those areas of government that a lot of people, when we learn about how a bill becomes a law, you don't learn about like this fourth stage, right? That comes
Right.
after the law has been passed. And obviously this is different because like you said, it's a rule, but right, our input is so invaluable and it feels kind of like a waste sometimes, but it's never a waste because all those comments are added up and have an impact.
That's right. And sometimes people can see areas that could be made stronger. And so even if it's not just a yes, we love this, it could be a yes, we love this and you could improve here. And sometimes they actually do. Like they are required by law to respond to comments. They're not required to take all recommendations,
Mm.
but they are required to respond. And so they do have to take everything into consideration at least.
Yeah, that's great.
So we've talked a lot about HHS. Uh, but it's not only HHS. Um, so what other agencies are you thinking about? What other policies are kind of top of mind um, as we start this new administration?
Yeah. Well, I think one thing is, in the previous administration, pro abortion initiatives just infiltrated every department, and like you said, HHS really leads on a lot of these issues. But what we saw with the Biden administration is that they stuck pro abortion policies everywhere in all kinds of
Everywhere.
departments.
Mm-hmm.
And so to undo that, we have a responsibility and opportunity. I feel like one responsibility to pull back all of those efforts from all of those departments, but then also to similarly do that of advance pro-life policies maybe in creative ways in creative departments that we hadn't thought of before.
Mm-hmm.
um, so that's kind of one thing, and some of the other nominees that we're going to be watching are within HHS, and so we don't really need to go into those. But FDA, NIH, Food and Drug Administration, and National Institute of Health. Sorry, we throw around a lot of acronyms, and I forget sometimes we don't always remember what they stand for. But another one, that we've been talking about recently is the Department of Justice and the Attorney General, who was recently confirmed. And so do you want to share with us kind of what you've even been watching on that front of how she is kind of already showing how she could have an impact in this area too?
Yeah, Pam Bondi is our new Attorney General, and um, she is really an ally on the life issue, which is so exciting. Um, She did great things defending pro-life legislation in Florida when she was the attorney general there. And we expect that she will continue to do that. If I can tell you a quick side case and then bring it into the DOJ real fast. Some of you may have heard about the whole idea of shield laws. Some pro-abortion states like New York have passed these wildly unconstitutional laws that have been known as shield laws, um, having to do with abortion drugs and some with uh, mailing like puberty blocker drugs and things for transitions. And the whole point is if there is a state where transitioning kids or abortion drugs are illegal, well, New York has passed a shield law, and that means they're going to shield their doctors from any sort of liability for illegally shipping those drugs into the states where they have been made illegal. So there are two cases right now, one in Texas and one in Louisiana, against the same abortionist, Dr. Carpenter, in New York. She has been shipping abortion drugs all throughout the nation ever since mail order abortion drugs became legal by the FDA. And in these cases, drugs that she had prescribed into states where they are illegal resulted in girls ending up in the emergency room. And so the states are suing her. Well, the Louisiana case is particularly interesting. I'll try to make this really short. It's a minor girl who got pregnant, but she was excited and she was planning her gender reveal party. Well, her mom didn't want her to have this baby. So the mom, who was not pregnant, ordered abortion drugs online from Dr. Carpenter in New York, got them, even though she was not pregnant. She ordered and got these drugs, forced her minor daughter to take them, which ended the life of her unborn child and ended up with her in the emergency room. The whole, like everything about the story is tragic. But what is happening now is Attorney General of Louisiana, Liz Murrill, has brought a lawsuit against this doctor in New York. And the district attorney, who's actually the one in charge of the case, was with Pam Bondi recently and happened to ask her, will you join us? Will you help us in this case? And she said, yeah, I'd love to. Now, what that means as far as like how official it is, I don't know, but she's very interested. And why this matters is because of New York's shield law. They're not going to extradite the doctor to New York for prosecution. Kathy Hochul, the governor of New York, has said, no way, we're not doing that. And Governor Landry of Louisiana just said, oh, you have to extradite her now, which means it's going to be Louisiana versus New York, and we might see this in federal court soon. But the DOJ could intervene in that situation. They could join and use this situation to get to the root of these issues, which is mail order abortion drugs and also the unconstitutionality of shield laws. I'm sorry, that was kind of a lot, but I'm
No,
really excited
it's
about
so
this
important,
case.
and that's it. You know, it's on the news right now. We need to talk about it, and I think that highlights certainly the exciting role that our federal AG can actually have in our issue. But I think it also kind of ties back to what we were talking about just a little bit ago of the dangers of abortion drugs,
Mhm.
why the safety, you know, needs to be reviewed by our new Secretary of HHS, and also just how the FDA removing all of those regulations is a federal overreach because we have, you know, with Dobbs, the issue of abortion has been returned to the states. States have made very different decisions about that and about abortion pills. Like you said, you know, Texas and Louisiana that have prohibited them. Okay, states like New York that have made them accessible. And by the federal government, you know, removing any sort of restrictions, they're sort of undoing the state laws that are trying to protect their preborn residents, protect their pregnant women. And so it's kind of just created where we are now. And so it is certainly heartening to hear her say that and see what she's going to do. And I know, like when we talk a little bit later about some of the executive orders that came out, you know, she has jurisdiction in some of those things as well. Do you think are there, you know, I know certainly our new Secretary of State, Marco Rubio, is very pro-life, and that will, who knows what that will look like for his role. Are there any other departments that you are watching or thinking about that could even continue to have an impact on our movement?
Yeah, I mean, like you said, the past administration put abortion everywhere, places it has never been before, like the Department of Defense, for example. Under the last administration, they reinterpreted law just on the fly and decided that law that says you can't pay for abortion with federal money means, but you can pay for things making the abortion possible, like travel, which is absurd and is the wrong interpretation of the law. But through that, they started funding abortion travel through the Department of Defense. Already, that has been rolled back. They got rid of that, I think, a week and a half, 2 weeks ago. That was very exciting. One of the things we're still looking for is a similar thing in the Department of Veterans Affairs. There's longstanding law since '92 that says that the Department of Veterans Affairs will not pay for abortions. And the Biden administration said, except now you can. They just basically ignored the law and interpreted some words to mean things they never did before. And all of a sudden they were doing elective abortions at VA hospitals, which is blatantly illegal. And so, but the good news is Doug Collins, who has recently been confirmed as Secretary of the VA, is very pro-life. He knows the law. He even talked about it during his confirmation hearings. He was a very pro-life member of Congress before. And I think it's I keep refreshing the website to see if anything has started there, because I know it's a priority for him to get abortion out of the VA.
Yeah, that's so important. I think just one more thing I wanted to talk about, and kind of looping back to what we talked about before we move on to the executive orders, is, we talked about the role of HHS, of returning some of the safety protocols for the abortion drugs. And we did talk about conscience, but I want to just pause there again, because for us as patients, and then for our medical professional members, of, that this issue is so important. And so, how I guess I want to talk about how can we actually see HHS make an impact on conscience rights, because we talked about it, but like, what is that actually going to look like with a new secretary in place, and in the new administration?
Mhm. We saw a lot of action on conscience under Trump's first administration. We have some good language in law and in the government funding bills that are supposed to protect the consciences of people and entities that don't want to participate in abortion, refer for abortion, cover abortion on their health plans, do training for abortion, all of those things, but they don't have enforcement mechanisms in the law. And so, really, it's up to the discretion of the Department of Justice and HHS as to whether they, HHS first, I should have said, whether they actually enforce those laws that fall under their jurisdiction. And so, in the first Trump administration, they basically said, do you have an example, or are you someone who has had your conscience violated? Tell us if so, because we want to get justice for you. And so they were very, very busy, because all of a sudden people knew, oh, someone's going to listen to me and protect my conscience. And so they they did a lot. They brought lawsuits against the state of California, for example, for forcing folks to be involved in healthcare, in abortion coverage on their healthcare plans and things like that. So I think I'm looking for similar things in this second Trump administration. They're still building out their staff and all of that. So how exactly the apparatus will look this time, I don't know. But they had created a special conscience and religious freedom division at HHS last time that the Biden administration got rid of. So I don't know exactly what it'll look like, but I think there are a lot of opportunities. Like you said, the last administration was so aggressive, and so I think there's probably a lot that needs to be corrected uh, with this one.
Yeah. Well, and I know, like, under the Biden administration, right, some of the cases that were still pending were just dismissed without investigation and without justice. And so I don't know if anything can be done on those per se, but it will be heartening if there is, again, that opportunity for people who have had their conscience violated, or at least knowing that there is a protection in place out there. If that happens, hopefully it never happens, but when it does, that there is that opportunity for justice in place. Should we move to talk about all these executive orders that have
Let's
happened
do
in the past couple weeks? I'll let you kick it off.
Yes. Yeah. So it you never know what's going to happen in the first week or two of a new administration, but a lot of times that will give a good indication of their priorities. And so it was very encouraging to see several pro-life things happen very quickly in the first few days of this administration. And inauguration happened on Monday. The March for Life happened on Friday. So it was a big pro-life week. Do you want to talk about the march?
Sure, yeah. So right, it was a huge week, a lot going on, and the inauguration impacted the march, but it was still a great event. The March for Life was still a great event, a wonderful opportunity to all show up in force. And it was so cool, because our new vice president, JD Vance, actually was there. And what was even more amazing was that he shared with the crowd that this was his first official, I guess, appearance, I guess would be the
Mhm.
word, as vice president. And so I think that's just really encouraging, like you said, for the new administration, that the vice president, his first appearance would be at the March for Life. And he made a comment even of like, we'll be back next year, and talked about his kids. And right, it was just fun to see kids at the inauguration. And I'm sure they were so tired. And at the same token, President Trump sent a video too to the March for Life that we all were able to watch there. And because he couldn't be there, I think he was in California helping with the wildfire situation. But that was just it just showed again the importance of this of life to this administration. I know there's been a lot of concern in the campaign, and right, all this that we're talking about doesn't necessarily mean that all of those concerns are gone. It's just encouraging, and I think we have a lot to be hopeful about. And for whatever has been talked about or happened, we still have a lot to be hopeful about and excited about. And so something like coming to the March for Life and making that one of your first appearances or a priority to make a video is just encouraging. And it was very it was very uplifting to the crowd that was there to watch that and see that.
Yeah, it was.
Another one, oh sorry, go ahead.
No, it's just exciting after the last 4 years of marching, but knowing that the White House is right there doing everything they can to stop what we're doing at the march. It just felt so different. It was
Yeah,
exciting.
yeah, totally. So right, a lot of things happened that first week. These might not all be in the right order, but I think given that we talked about the Department of Justice and the Attorney General's role, do you want to share about the executive order pardoning the FACE Act prisoners and what that was all entailed?
Yes, that was also very exciting. So the FACE Act is a federal law um, that is supposedly was supposed to even-handedly protect abortion clinics and pro-life entities from violence and that sort of thing. However, since it was enacted, it has been used far more times to prosecute peaceful pro-life protesters rather than actual violent people who have defaced or vandalized or actually been violent at pro-life entities, pregnancy centers, things like that. So it's a law that has really become weaponized. And the Biden Department of Justice was so aggressive in their prosecutions under the FACE Act. And we have been advocating for the release of prisoners who were singing and praying at abortion facilities and who were trying to talk to women on their way into the clinics and tell them there was a better way. And there were people who were in prison for months or years long sentences and for nonviolent action. And so a lot of the pro-life movement had been asking the Trump administration, as soon as you get in, please pardon these folks. And he did. And he signed, there were 23 people who were pardoned, and they've been posting videos of being reunited with their families. And it's just, he said when he signed it, these people never should have been prosecuted in the first place. And that was really exciting. I think, yeah, the aggressive nature of the last administration was, I mean, they did things you wouldn't even think were possible, like throwing grandmas in prison for
Right.
protesting at these places peacefully. But they're home now, and we're so, so grateful for that. But also, he has removed us from some other things, some other entities, and gotten rid of some websites and things. Can you tell us more about those?
Yeah. So some of the other things, and right, some of these sound, they don't require a bunch of explanation, but for instance, one of his very first actions was canceling reproductiverights.org. Okay, well, canceling a website doesn't sound like so very much, but this website was set up by the Biden administration after Dobbs, of highlighting mifepristone is still available. You can still access the abortion pill. You can still access abortion in your state. And with the guise and the euphemism of reproductive care, but really just promoting abortion. And so for the administration shutting down that website right away was great. Like you said, there are better options, and we want to, moving forward, promote those rather than just promoting abortion. But another thing he did early on was withdrawing us from the World Health Organization, the WHO. And this was right. I think we all learned about them, whether you knew about them before or not during COVID. But specifically, thinking about how it relates to our issue, they are so aggressively promoting of abortion overseas, ignoring the dangers of the abortion drug. And like we've said already, these requirements for safety that were put in place initially have been withdrawn. Things like an in-person visit, things like how late into pregnancy you can safely use the drug, these different aspects. And so for the World Health Organization just to wildly promote these drugs like they're easy enough to take and have no safety issues is dangerous. And so that was encouraging to see him withdraw us from that. But in addition to withdrawing and stopping these things, right, he also had us as a country rejoin certain things too.
Yes, one of those things was the Geneva Consensus Declaration. That was a new multilateral declaration that was instituted in 2020 when he was president the first time. And it was a group of nations. It was the US, Brazil, Egypt, Hungary, Indonesia, and Uganda were kind of like the core nations that were helping get others on board. And the declaration simply said, basically that they wanted to advocate for real health care for women and that abortion is not an international right. And so we should not be forcing other nations to legalize abortion, for example. And so it's simple, but it's powerful because there's so much pressure on nations, especially strings attached to funding for laws to be changed. And this was just a declaration that no, nations should be able to make their own laws when it comes to life and abortion. And so Biden had taken us off as a co-signer of the declaration week 1, and Senator Marco Rubio, week 1, got us back on there, which was exciting.
Yeah, sorry, I was just gonna say, I think that fits in really well with another thing that was early on, which was enforcing the Hyde Amendment, another executive order to reinforce the Hyde Amendment and reinstate us in the Mexico City policy. And I'll just kind of talk about one of them, and then I'll let you talk about the other. But so for the Hyde Amendment, right? This is an amendment that has been in our funding bills for a very long time, and it prohibits taxpayer dollars from funding induced abortions. So there are those exceptions that are included in there for rape and incest and when the life of the mother is in danger. But it stops taxpayer funding of abortions. And, it's been in place. And so him just reinforcing the importance of that was great to see. And so that was national, taxpayer funding nationally. But then he also made this action internationally with the Mexico City policy.
Yeah, the Mexico City policy was first was a policy made by President Reagan. And ever since then, it has been the Democrat president has gotten us out of that policy and the Republican president has put us back in. So it's kind of been this ping pong effect. We're back in. But the first Trump administration took the Mexico City policy and expanded it into the Protecting Life and Global Health Assistance, or Global Protect Life rule. Which basically just says our foreign aid money, all our health spending, all our aid money cannot go to entities that are performing and promoting abortions, because a lot of overseas entities get there's kind of a status that comes along with being a grantee of federal funding from the US. And so if those people are then turning around and trying to change laws in pro-life countries, say in Africa, for example, and saying they have to pass abortion laws, well, then it looks like America is actually telling them to do that. And so the policy is just basically saying, no, if we're sending you our aid money for health or whatever, then you can't be involved in abortion there. So he made it much bigger than just, the Reagan one was a little more limited in what coverage or what programs were covered. Trump made it a lot bigger to cover all of our health foreign aid money. So that was that is really important. It covers many billions of dollars of foreign aid, and makes sure that the money is actually going to life affirming entities that are doing real work for maternal health care, for actual care for babies, prenatal, postnatal, and not going to entities that are pushing an abortion agenda above all else.
Yeah. Or feeling just like you said, that pressure, like, well, are we supposed to be doing that when
Right,
that's not the point of the funding? Yeah,
right.
that's so good. I think now we probably can switch to some questions from our viewers, and I know we have a lot coming in. Um, this first one says, do you think that under this administration, there will be a requirement that every state keep track of all abortions done and submit those numbers and abortion adverse events?
Well, that would be incredible. Right now, it's voluntary, which is kind of crazy that we like calling it the abortion distortion. The same rules that apply for anything else health related somehow do not apply when abortion is part of the conversation. And so reporting complications, all of those things, yes, those happen everywhere else, but not with abortion. And so I think CMS could have a lot to do with that. We are very interested in getting them to start requiring more reporting from different states, because when you're trying to make health policies, you should be looking at all the data, right? Like if you're looking
Right.
at maternal mortality or maternal morbidity, and you're looking at all the factors that are involved, but you're ignoring abortion altogether, then you have an incomplete picture and you can't make good policy. So, do I think it will be required? I certainly want it to be. I know that's something that has been in the works for many years under various administrations. It's not easy to do, but we're certainly going to try.
I think also it's one of those things that seems really common sense. Like, why wouldn't
Hmm.
we just have this data? But anything relating to abortion or the pro-life movement requires so much capital to pass or get done. Like,
Yeah.
even, we didn't really talk about this, but during the March for Life week, the House and Senate considered the Born Alive Abortion Survivors Protection Act. And this is just a common sense piece of legislation to provide care if a baby is born after an attempted abortion, that they receive the same level of care of another baby at the same gestational age. And the House passed this bill, the Senate didn't. And it seems sort of ridiculous that why would you not pass this bill? But because it's protecting preborn children to a certain extent right after they're born,
Hmm.
and because it highlights what induced abortion is, it just takes a lot of work. And so I think that's true on this too. Of abortion reporting should be pretty straightforward, abortion complication reporting, but it's just hard to get even things that seem straightforward done.
That's right. And same with adverse events. I mean, we talked about that some with RFK, but that that will take a lot of work. But hopefully, he can direct the FDA to do some real studies and some unbiased looking at the situation, and maybe go back to reinstating the REMS.
Right.
All right. Do we think we'll get to the point where Planned Parenthood is completely defunded?
I think that's a great question. And I think that's kind of the same answer what we gave before. I know that, I know we've all seen in the news all the budget conversations going on with the government shutdown deadline looming and thinking about funding for this year and next year. And I know that's part of the conversation that they want to achieve. But I think the other problem, like we were talking about with the Biden administration, kind of pushing pro abortion policies into all these different areas, is Planned Parenthood is funded through all kinds of different areas in our government, areas you wouldn't even think of, and in ways that it's all tied up, and trying to untangle that is hard. Not saying it's not worth it and not saying it can't be achieved, but it's hard. So I think this is one of those things like we keep fighting for it and we keep doing what we can, and maybe we can get there, and hopefully in a way that then is not just reversed by another administration.
And what's interesting is right now, you've probably heard in the news, Congress is working on something called budget reconciliation, which is, I won't get into the details of what that means because it's procedurally very technical. But the bottom line is it's the one piece of legislation that can get across, that can be passed through the Senate without needing to break the 60 vote filibuster threshold. All you need is a simple majority. And so it's possible, it is absolutely not a given, but it is possible that there's an opportunity there on budget reconciliation to defund Planned Parenthood of its Medicaid dollars. That will require a whole lot of work by everyone on this call, so many people. But honestly, a lot of defunding Planned Parenthood depends on America understanding what Planned Parenthood does.
Mm.
And a lot of Americans don't even realize that Planned Parenthood does abortions, or that that's their main source of business, or that they turn around and spend multiple millions of dollars to unseat Republicans and get Democrats who are very aggressively pro-abortion in those seats. And so like we have to really educate people on the terrible abuses that happen within Planned Parenthood, how they are responsible for almost 40% of abortions that happen in our nation, and they get like $700 million of taxpayer funding every single year, which is about $2 million every single day. And it would be amazing to defund them.
It's almost mind blowing that amount of money, it's kind of hard to process.
Yeah.
But and so just for all of us with the budget reconciliation, right? That's the deadline that's coming up on March 14th, 15th, somewhere around there, right?
So actually, no, but all of this is happening in March. So the government
Okay.
funding ends on March 14th. So that's that deadline. But the budget reconciliation is a whole different vehicle that's happening at the same time, which is why
Okay.
it gets
So these are
confusing.
different
These are
conversations.
different. Yes. So the government funding, that deadline of March 14th, those government funding bills require 60 votes in the Senate. So people have tried before to defund Planned Parenthood that way, but we can never get to 60 votes in the
Mhm.
Senate. So that's why this other thing that's happening at the same time, also having to do with dollars, so it gets very confusing. That's why it's the better vehicle for this, because you only need 51 votes in the Senate rather than 60.
Totally. So when we're hearing about this March 14th looming deadline, obviously that's important, but for a
Yeah,
different reason, not for
correct.
this conversation about defunding Planned Parenthood.
That's right.
Okay, another question we have is, speaking of funding, are pro-life pregnancy centers getting federal funding?
That is a tricky one because we would love for them to get federal funding. Some pregnancy centers don't want federal funding because they don't want the strings that are attached sometimes to that money. Even if those strings are cut during certain administrations. So it can be a little tricky, but the Biden administration, again, tried to go after funding for what funding there is for pregnancy centers through the TANF funding, which there are a handful of states that were using the temporary assistance for needy families funding to fund pregnancy centers that were helping needy families. And the Biden administration said, yeah, we think that pregnancy centers should not qualify for TANF money, even though they are literally doing the purpose of the TANF program. So that one is tricky, but we are looking to see if there's some creative ways of getting money to the pregnancy centers in a way that is not burdensome. It's kind of complicated, but it would be incredible to figure that out. It's a hard nut to crack. All right, what do we do about abortion pills coming in from overseas?
Oh my goodness, right. I think this is this is the new frontier for our movement is abortion drugs and them coming in from overseas. I think it's a couple factors. One, right, the FDA loosening the restrictions has only made it easier. And I think there is work to be done at the state level, but I think most of the effort we're going to have to do to address them coming in from overseas is going to have to be federal because there's only so much the states can really do on this front. I do think there are some creative ideas as far as this goes, like something with the post office or different provisions of law that are already in place or utilizing federal agencies, but it's honestly a really hard question. And I don't know that we as a movement really have a good answer yet. I think we're still trying to figure out how to address that. And I think right now our focus is on educating of like when these drugs are coming in from overseas, it's really dangerous. They're not regulated through our systems like the FDA. So you don't know what is in the pills, like if it is actually the amount of the drug that you're expecting, and it could be way less, it could be way more, it could be something else that could be really dangerous. And so we don't really have an answer on that yet, to be totally honest. And I know that's like not very satisfying to hear, but I think that's something we have to keep figuring out and addressing. But I do think there are some we have very innovative minds on our side, and I know there are innovative thoughts about how to do that. Do you have any other thoughts on that, Jamie, too?
I mean, I agree. It's so complicated. There's a group called Aid Access that is one of the largest organizations that ships drugs in from overseas. The Trump administration did, or excuse me, the FDA under Trump, I believe, did send them a cease and desist letter last time, but there wasn't really time for enforcement. And what enforcement looks like is, like you were saying, that is the really hard thing, because if you don't say on your package slip, like, this contains mifepristone for the purpose of abortion, like it's, it would be a massively expensive and complicated process to figure out how to stop that. So I mean, I think you're right. There's so much to do within the just mailing of abortion in our own country among the states, and also educating, like you said, on don't do this to yourself. Like, this is really dangerous. Please, like,
Yeah.
stop and think, and then hopefully get better care. But it is a tough one.
And I think, you mentioned the shield laws that we already are seeing in our country from state to state. I think this would be an issue on that. These, like you mentioned, aid access, they're headquartered in a different country. Then they get the prescription of the drugs from a different country, and then that's shipped here. So who do you hold accountable?
Right.
And then how do you actually extradite them here to be held accountable?
Right.
So we need to still work on that for sure.
Mm-hmm.
Okay, I think our last question that we have anyway on right now is who will head the Office of Civil Rights in HHS? That we were making progress there regarding denying care for premature babies.
That was exciting. That was happening like right at the end of the first Trump administration. And some of the people that were working on that are careers, which means that they are federal government workers who stayed even when Biden was president. They weren't the politicals that come in and out with the administration. I don't believe the head of Office of Civil Rights has been named yet, or if they have, I have forgotten.
I don't think they have either. I think it's an interim person for right now.
They're still naming assistant secretaries and building out their teams and all of that. So I think there are good people being put in positions, but I have not heard that one specifically yet. Although some of those who worked in that division before, excuse me, that office are still there. So I'm sure they will be glad to do things that they have not been able to do over the last 4 years. Mm-hmm. But I think, Rebecca, you said earlier about RFK saying he's hiring pro-life staff. And there's that saying, personnel is policy. And it's so true. So I would even say to folks on this webinar, if you know of people who are interested in working for the administration, who have, you know, pro-life and medical expertise, scientific expertise, ethics, legal expertise, any kind of expertise like that, the teams are still being built. And so it is so incredibly important to get people in those roles, not only who have expertise, but who are committed to the life issue. And so, so if you have recommendations, uh, send them in.
Yeah. Yeah, that's great. Okay, I think that's all of our questions, and we're just about at time. So I'm going to just wrap up with a few last announcements for everyone. As you may know, the Matthew Wolfen Educational Conference is coming up February 28th to March 2nd, and registration has actually been extended to February 19th. So sign up today if you haven't done so. The website is conference.applog.org. This is just a great opportunity. It's a medical conference with medical talks, but it's also an opportunity to be around like-minded fellow medical professionals, medical students, policymakers. It's a great opportunity. The other thing is, if you're a physician but you can't make the conference in person, several of the MBEC lectures, like I said, it's a medical conference, they're going to be available for continuing medical education credits a few weeks after the conference. And so if you're interested in that, go to the same website, conference.applog.org. You can click the CME tab and find out the information there. One last thing, again, to our medical professionals watching, we are currently gathering signatures for a petition calling on the American College of Obstetricians and Gynecologists, ACOG, to stop falsely representing pro-life laws and blaming the unfortunate and devastating deaths of women on pro-life laws, and to start prioritizing facts over a political agenda. And so if you are interested in joining us with that, to try to push back on that false narrative, to learn more about it and to sign up, you can go to applog.org/petition and find out all the information there and sign up. And so with that, to honor our time, and thank you, Jamie, for hopping on and having this conversation. I hope it was helpful for everyone to just kind of get caught up with where we are and all the great opportunities and activities that already been going on. And as always, you can follow us on Facebook, X, YouTube, you're here now, Instagram to keep up with what's going on, and check out our website, applog.org and applogaction.org. And thanks for joining. We'll see you next time.